I'll be talking today on an appraisal of factors associated with treatment compliance in the care of hypertensive patients in Nigeria. Hypertension is a very common non-communicable disease posing a lot of threat to lots of people in our world. Despite its popularity and its massive effects on the health and wellness of individuals, it is often poorly controlled due to several reasons. This review is embarked on to identify various issues connected with treatment compliance in the care of patients having hypertension in Nigeria. The paper is written for the purpose of exploring the strategic formulation of care modalities involved in the care of hypertensive patients in Nigeria, and also to understand the various compliance issues that are encountered by both patients and their healthcare providers during management of hypertension. For this study, a systematic review of literature was used, who made database, Google Scholar, Cochrane, and the Agency for Health Research and Quality, AHRQ search engines, were used in order to gather data. The outcome indicated that there are manifold interrelated factors militating against compliance, which must all be addressed for a better adherence to occur. Some of these factors include high cost of medication and its unpleasant side effects, educational status of patients, and the types of facilities where patients receive treatment. The study concludes that collaborative efforts of patients, healthcare providers, and systems are of paramount importance, and it is recommended that hypertensive cases are handled by specialists. Introduction. Hypertension, also known as high blood pressure, is one of the chief common non-communicable diseases of international public health concerns, which constitute a worldwide health burden. And its effects include cardiovascular diseases, stroke, heart failure, renal failure, which are some of the major causes of morbidity and mortality worldwide. The prevalence in Nigeria. This is connected with drastic urbanization of the population, which affects eating pattern and lifestyle in general. Also, social stress, consumption of salty, fatty, sugary fast food, obesity, lack of exercise, and debt-bound way of life, that is, sedentary lifestyle. A greater threat of hypertension is expected in metropolitan populace of sub-Saharan Africa, which is projected to increase. So, some factors identified contributing to the prevalence of hypertension include issues regarding compliance on the part of the patient, the competency of the healthcare system and the healthcare team, socioeconomic factor, therapy-related reasons, then the disease condition itself are also of great impact. So, key reasons for blood pressure control: inadequate therapeutic adherence to prescribed medication or treatment modalities, then ignoring treatment guidelines and plans. The utmost shared cardiovascular hazard in Nigeria. Hypertension, about 2% of sudden deaths are attributed to hypertension. Then severe myocardial infarction, 4%. Occurrence of hypertension in Nigeria. This varies depending on the populace being screened, and the average range is between 8% to by accuracy et al. In 2003, they identified the range is between 8% to 46.4%. This corresponds also with a systematic review of 43 other studies conducted in Nigeria here. Findings of 40 to 45% was also identified. The background of the study. Hypertension is usually asymptomatic until blood pressure is highly elevated or inception of end organ damage. The prevalence of hypertension among Nigerians living in rural and semi-rural, semi-urban, and amid a market population was 32.8% and 42.2% respectively. there is an urgent need to intervene appropriately to reduce the possible occurrence of several other conditions associated with hypertension. It is mandatory for all nurses and other health care providers to take the direction of evidence-based practice to accurately carry out their duties through the use of existing evidence with regards to quality patient assessment, history taking, including identifying potential risk factors and adhering to therapeutic treatment modalities through the use of health promotion and other patient-centered care modalities and management. Inefficacies of healthcare organizations and healthcare team in terms of meeting patients' expectations have created some sort of inaccurate belief and attitude towards hypertension and its treatment in Nigeria. Nevertheless, there are some peculiarities inherent in patients and society in which they reside that are linked to the treatment compliance issue. Now, statement of the problem. Hypertension is a universally documented problem with a proliferating detrimental consequence on the well-being of youths and adults. In spite of this increased awareness regarding the peril of hypertension, its prevalence has persistently remained high among Nigerians ages 18 years and above. Objective of the study. This review study is conducted to identify the various factors associated with the planning and management of adherence modalities in the care of patients with hypertension in Nigeria. This will provide clues to formulating adherence and intervention prototype to be used in public and private health facilities. Now, the significance of the study, which is divided into three parts, considering the patient, the healthcare system, or the healthcare team, and the government. So the patient, factors responsible for poor adherence will be identified and addressed with regards to the patient's specific need. This will in turn keep them motivated, interested, and informed about their health needs. To the healthcare team, healthcare professionals will find it necessary to fully utilize laid down guidelines and core competencies in planning and attending to patient care. To the government will deem it necessary to invest in the healthcare system, team, health insurance, and policy-making reforms. Research questions. How could healthcare provider affect patients' compliance level to the treatment of hypertension? What determines patients' compliance to hypertensive treatment? What measures can be used to ensure compliance in the treatment of hypertension? The scope of the study. The study explored the factors affecting treatment compliance in the care of hypertensive patients in Nigeria aged 18 years and above. Limitation. The study was not uniformly distributed among the various geopolitical zones, and there were significant variations from hospital to hospital in practices and management protocols. Then there are shortages of some previous literatures. From literature review, considering factors affecting treatment adherence to hypertensive patients, evidence-based practice, team-based hypertension care, then core competencies healthcare professionals need. For factors affecting treatment adherence, we have those factors that are related to the patient, the therapy itself, the healthcare system and the system factor, socioeconomic factors, disease condition factors itself. About the disease condition factor itself, we are considering association of hypertension with other diseases, then the asymptomatic nature of hypertension at the early stage. Evidence-based practice. Aki and Aki 2015 reported that participants attending specialty clinic appears to comply better to antihypertensive prescriptions. Compliance devotion differs based on the clinic enrolled. Based on the clinic enrollee we are attending, compliance among those attending specialist cardiology clinics was at about 84%, 84.8%, while their counterparts who were being seen by family physicians and general practitioners at the GOPD clinic had just 57.2% level of compliance. This finding is consistent with that of Chijioke et al. 2016, who reported that management of controlled rates remained better in the secondary care medical outpatient department clinic when compared with the primary care general outpatient department center. For evidence-based practice, according to study by Kented and Becker 2016, there is significant evidence to support nurse-led care involvement in the management of hypertension. These are evidence-built strategies utilized by nurses, and they include patient-provider training and education, patient healthcare provider reminder system, registered nurse prescribing, team-centered care, home blood pressure monitoring, and the routine usage of treatment algorithms. These evidence-based methods have been considered to be cost-effective, and it's a form of tax-sharing strategies, that is, based dissemination of primary care obligations from physician to non-physician healthcare workers due to workforce shortage. In Nigeria, there is little or no evidence in place about the effectiveness of nurse-led service intervention in the regulation of high blood pressure. We also have team-based care. Team-based care hypertension management puts into consideration the patient and significant others, their main care provider, and other professionals who complement the job of the main care provider by means of giving adequate support and distribution of duties regarding hypertension care, such as prescription management, proper blood pressure measurement techniques to foster self-management, support, and on-the-go patient follow-up compliance. Several studies have established that nurses' role in patient health promotion considerably enhance patients' daily health and lifestyle behavior, drug adherence, self-efficacy, and reduce BMI, body mass index. These are considered as essential facets for lifelong control of blood pressure in the society. Now, the core competencies healthcare professionals need to possess. They include providing patient-centered care, which has to do with recognizing the patient as an individual, treating the patient as an individual, and allowing the patient to participate in his or her care, which will help in empowering the patients to take care of his or her healthcare needs and motivate them in order to comply with treatment modalities. Working with interdisciplinary team, that is collaborating with other healthcare workers. This helps to prevent. So also the utilization of informatics, that is communicating management knowledge, understanding, and reducing error when it comes to decision making. In conclusion, okay, my findings, I actually made use of an aggregate of 160 articles, out of which, after pooling, 30 articles met the inclusion criteria. And overall, all the articles used have these basically as the major factors that affect compliance to treatment of hypertension. In conclusion, this study deliberates on the factors linked with planning and treatment compliance in hypertensive individuals in Nigeria. The prevalence of hypertension in Nigeria is compelled by manifold factors at work, which is very similar to what obtains worldwide. The major overall characteristics of identified factors inhibiting hypertension treatment and planning are summarized as indicated in the table above. The study showed that evidence-based strategies through the use of specialized hypertension clinic, support of nurse-led care, and the routine usage of treatment algorithms aid better management outcome. Healthcare providers need to create adequate time to address patient knowledge needs by providing patient-centered care. Thank you very much for listening.